Joining me is Dr. Bob Weil, and he's back on the show for the Sports Doctor is In segment. He is a respected sports podiatrist and radio host of the Sports Doctor. And we're always excited to have him back on the show. And this month's topic, we talk about common running injuries. And it's live from Chicago or from Vancouver, Canada. Welcome back, Dr. Bob.
Hey, from one country to the other. Always good to be with you. And again, to discuss some of these really common challenges and questions. And one of the most common ones are the running-related, usually overuse injuries. So first of all, I want to just give a little bit difference. There are two types of injuries. One is acute, like you stepped in a hole, you sprained an ankle, you were injured, it just happened. Overuse injury is a different animal. Most people can't remember. I don't remember when my shin started hurting me. There wasn't any specific incident. Usually, again, it's from overuse. So we want to list some of the common overuse injuries and what to pay attention to, especially in runners that are involved. So the most common problem we see in runners with overuse are plantar fasciitis. And I'll list some and then we'll talk about them. Plantar fasciitis, Achilles tendonitis or problems, shin splints, another common one, runner's knee, another common overuse injury, again related to either sometimes the terrible twos are mixed in, Christine, where we're doing too much, we're being too aggressive, maybe we're adding on with our training too much, and things start to say, hey, back off a little bit. So plantar fasciitis is number one. It's the most common problem we see in active people, including runners and many athletes, the arch and the heel. Plantar fascia is a band-like fascia that runs from the toes to the heel. And commonly, it's the bottom of the heel that hurts. Also, it's commonly the arch that hurts. And this is probably the most common overuse injury that we see. Broken down shoes, biomechanical problems, all of these things can go into, especially if these injuries are repetitive. And this is one of the things we really want to make a point about with your listeners, is when overuse injuries become recurrent or repetitive, we want to start paying attention then to foot mechanics. Are you flat-footed? Do you have high arches? Are you bow-legged? Are your leg lengths equal, et cetera? You want to start paying attention to that. Intelligent rest is the term I use a lot, which again means to back off, maybe be a walker for a week or two. Don't try to push through. Many times we'll see a stress fracture that results as a reluctance to back off from maybe the ball of the foot hurting. So we want to pay attention to those kinds of ideas. Achilles tendon is the biggest, strongest tendon in the body. It attaches to the back of the ankle, back of the heel. And again, it's also commonly aggravated in runners who are either overdoing it, common overuse concern. So are shin splints. Even though shin splints, Christine, is not a medical diagnosis, you could have a stress fracture. You could have a tendonitis. So you could have a muscle inflammation. So people need to not rely on shin splints as a definition, but it's a generalization. The inner lower leg, inner shin area is very, very commonly involved with shin splints. Want to put in runner's knee also, where we see tendonitis of the patella tendon, the tendon that attaches the kneecap to the shin bone, or other areas around the knee. Half the girls and women I've seen, Christine, over my whole career as a sports podiatrist is knee trouble. It's not someone who tears a knee who has an acute injury. It says, Dr. Weil, I picked up my amount of running. I'm being a little more aggressive. My knees are hurting me. And we find out many times that excessive pronation might be a problem. So again, overuse, you want to pay attention to whether you are adding things on too aggressively. You're not paying attention if things starting hurting, getting a diagnosis. Again, paying attention to your shoes. Are you starting to break down the shoes? If you run 4 or 5 days a week, you should be replacing your shoes at least twice a year. The shock absorbing materials start to break down. We're not looking for holes in the bottom of your shoes. We're looking for the fact that maybe you're breaking down the uppers. You can spend $200 for running shoes, Christine, and they still break down over continued use. So you really want to pay attention to those kinds of factors. Treatments, of overuse injuries, many times, again, number one, back off, intelligent rest. Give yourself 5-10 days off from being in your running repertoire. Again, number two, you might consider some ice massage to the area a couple of times a day, even though we're seeing more and more evidence that ice really is a numbing agent. It really doesn't have very much to do with healing. But for the first few days, many times we might do a little bit of ice massage. We might then switch after a few days, for instance, to whirlpool or moist heat on an area. Over-the-counter anti-inflammatory medications like ibuprofen, naproxen, we use a lot in order to calm things down, to act as a anti-inflammatory. So what's your 2 cents? Any questions?
Yes. Well, are people getting, like, runners get more injured or athletes get more injured as we get older? Do we have to really look at our biomechanics more often, like, or does
Yes, you should always be, if you're going to be an athlete, if you are a runner, which has specific one foot after another, if you look at your footprints on the sand walking, there's a distance between your feet, and you might see you're out-toed, you might see you're slightly in-toed. If you run, there's one foot in front of the other. The biomechanics of running is a different animal, for example, than walking or changing direction. So you always want to be paying attention to your biomechanics. Having a podiatrist give you some feedback. What about your biomechanics, especially if you're going to be a serious athlete or your son or daughter, cross-country runner, or they're playing a sport semi-seriously 4 or 5 days a week. Pay attention to problems if they're recurrent or if they are persistent. Almost always, again, I'll tell you one of my sports doctor pearls on the radio. If you have a persistent lower extremity problem, your back's a problem, your hips or knees are a problem, your feet or ankles are a problem, it's foot related. It is related many times to foot mechanics. The biomechanics of this is where we want to be paying attention. Orthotics, especially prescription orthotics, is one of our biggest weapons for all of these problems. Because biomechanical orthotics are to put your feet and lower legs in their best alignment for your best efficiency. So whether you're looking to enhance your performance or whether you're looking to prevent injuries, and these are the 2 areas that everybody cares about. Your coach, your parents, you, your teammates, you care about these 2 things, Christine. Can I prevent trouble? Can I stay? 50% of runners deal with some sort of injury. It's 50% at some point or another. So this is why we're really interested in preventing injuries, where we might be, again, doing a screening, watching you walk, watching you balance on one foot, talking to you about the type of shoe that you were already in. Shoe technology is changing all the time. It's enough to drive runners crazy. It's like, the car label. Every year they change. And, with all of the controversy of less is better and barefoot running and do I need support and all of these kinds of questions. So again, the other side of what's important is enhancing performance. Not everybody is interested in enhancing performance, but you as a competitive runner in the past, of course you were interested. Can you bring down your marathon or your 10K time? Can you enhance performance? And many times, again, it is about paying attention to biomechanics and strengthening. Every runner should be on a cross-training program, whether you want to swim, whether you want to be riding bikes, whether you want to include weightlifting, which we highly recommend circuit training. Years and years ago, Christine, we couldn't get runners to strength train. All they wanted to do was run more miles. And my very famous colleague, the famous Bob Guida, used to look at these runners and say, stand up straight. You're bent over. From all of this extension of some of these different muscles. And eventually, today, there's not a serious runner who doesn't include some type of cross-training. And the very, very important category, does everybody have their pen out? Rest and recovery. More is not better. No pain, no gain is stupid. Makes no sense. So again, we want to be very, very cognizant. See a good podiatrist, good physical therapist, having some analysis. How flexible are you? How strong is your core, for example? And again, many times with running, we would want to incorporate foot ankle strengthening big time, rubber bands, balance exercises to try to stay away from the epidemic in capital letters of overuse injuries in youth sports. And like you said, as we get older, of course, the strains and the recovery times change. So the idea again is you want to be enjoying your activity. You want to be taking advantage of the great health and fitness advantages that we get, whether we're a walker or a runner, that we're including exercise, reducing stress. We just don't want to be dealing with injuries all the time. So these are some of our hints for you guys with Run With It.
Dr. Bob Weil, thank you so much. Great information, as always. And if people want to reach out to you, where can they go?
They go to sportsdoctorradio.com and they can go to radio shows. They go back years. They could probably catch you half a dozen times on my show. There's all sorts of information in articles and magazines, information we write on MVP Magazine. We have thousands of followers on LinkedIn and Twitter. We publish a lot of important information, helpful information. So they can catch me at Twitter at SportsDoc, DOC Radio. And of course, once a month with our Sports Doctors In segment with the famous Christine Blanchet and Run With It. So it's always great to be with you, Christine.
Likewise. And can't wait for next month. Thanks, Dr. Bob Weil.
Thank you. Thanks, everybody.